And welcome to what will be episode 222, the commercialization of healthcare, part of our My Job series, where we're going to be talking to people about their jobs working in the UX space around healthcare. And these are designed both for those of you who might be interested in having a job like that, as well as some of you who have people like this as your coworkers. You don't really get what they do, and you're afraid to ask. And we hope our video will answer those questions. So before we jump in and meet today's panel, as always, I want to thank all of our paid Patreon members, patreon.com/CXCC. It's as little as $1 American per month, or you can also join for free. There's a free version as well, and that's kind of like my mailing list. You'll be the first to know stuff, and there's no algorithms, and it makes me very happy because boy, am I tired of algorithms. So, all right, so let's jump on in and meet our panel. Two of these people are new to me, so let's start with them. Chris, who are you?
Hi, I'm Chris Bredie. I am a clinical UX designer and researcher. I am based in London and also have an MBA. So approach things from a design and also business perspective. That's about me. Yeah.
Super. Amy, tell us your story.
Yeah, so I am the president and CEO of my own agency, Dream in Color. I've been doing that for about 12 years now, and I was deemed one of the top 3% of designers by TopTal, as well as a co-author for the book on diabetes, digital health, and telehealth. I don't just focus on, health tech. I do humanity tech, so anything around people and anything about humanity, that's really what I focus on, but I have a strong focus in healthcare. And I have been published and written articles. And yeah, that's a little bit about me.
Super, super. And our good returning friend, Gyles Morrison, tell us about you.
Hi, everyone. So I'm Dr. Gyles Morrison. I work as a clinical UX strategist. I've been in the field now for about 9.5 years. My work is very much focused on the experiences that clinicians and patients have with healthcare technology and services. And I've gone into this field after previously working as a medical doctor. A lot of the projects tend to be around digital therapeutics. So these are digital products that can prevent, manage, or treat disease. It involves behavioral science. And a big part of my work now that I've become more senior is looking at the business side of things. How do you make sure that these aren't just delivering on health outcomes, but are commercially viable businesses? Because how are you really going to deliver for the masses if the business falls over? So that's me in a nutshell.
Yeah, super. And this is a bit of a continuation of episode 220, which you can find on our YouTube channel, CX-CC, which stands for Customer Experience, Customer Centricity. 220 was Gyles and some other panelists talking about working in UX around behavior change. So Gyles, when you helped us schedule this super panel, this one ended up being called Commercialization of Healthcare. So can I put you on the spot and ask you to give a definition of that for our audience?
Sure. So when I thought about this sort of panel discussion, it was much more around the topic of less so achieving health outcomes, although that's intimately tied to the commercialization of healthcare, because there's no way that you can really have a commercial viable product unless you can prove you're going to be able to achieve health outcomes. But this is the side of healthcare that isn't spoken enough about in relation to UX design. And we have profound impact on the commercialization of healthcare because we are making products and services that the general public want to pay for, or at least engage with if there is another payer. So I thought it would be great to provide more insight into how the work of a UX professional feeds into that, and also the additional knowledge that even a lot of UXers just don't have, which is used when you're looking at making a commercial viable product in any industry, but particularly in healthcare.
Excellent. Thank you so much for that. So then let's go around the panelists, and I just want an example of kind of, since this is part of the My Job series, tell us a little bit about what kind of work you're doing day to day or week to week. Let me start with Amy.
Awesome. So I didn't add this to my intro, but I'm also a data visualization specialist and a patient myself. I have type 1 diabetes. I've had it since age 9. And so a part of my job actually bridges a little bit into what Dr. Gyles says, is truly really understanding the metrics of a business, the metrics and data for our users, and also the feasible product, like what can we actually build with the resource that we have when it comes to engineering. And so my job is really kind of a liaison between these areas. I'm not as strongly focused in the UX research, but I'm strongly focused in making sure that design impacts the ROI for each one of these companies. And that is by helping them to prioritize, what do we focus on first, second, third, fourth, fifth, etc., so that we can quickly move into market, test, and then iterate on top of that.
Now, you can be sure that my question later on is going to be, how do we measure that impact and ROI, which so many people struggle with. But for now, I'm going to stick with our first question and go over to Chris and talk about, what does your day-to-day or week-to-week look like in your job?
Yeah, absolutely. So as Amy mentioned, it changes a bit week to week, but I sit basically in between. I work for a medical device company and basically sit between the product team and the tech team, helping the product team conduct research and speak with customers, understand their pain points and how they use the device. So that can mean developing questionnaires, the kind of quintessential UX techniques, but also visiting users and seeing how they're actually using the device, using ethnographic studies. I find that's really helpful. And then understanding the kind of product needs and the product roadmap, then translating those into usable designs and handing them off to engineers to implement. So that's predominantly what I'm working on.
Love it. And Gyles, you want to tell us a little bit about your adventures?
Sure. So similar to when I was explaining the work that I do in general as a clinical UX strategist, my impact on the commercialization of a product falls within 3 categories. There's either me working as a strategist, working as an actual clinical UX practitioner, doing clinical UX work, or in an instructor and training people to work in this field. So let's go in reverse order. If it's the trading side, I'm making sure that they've got the sufficient knowledge and understanding of healthcare, and then they're working on projects they particularly identify clinical risk. Because if you've identified clinical risk and mitigated against that, you're probably going to save your employer or your client a lot of money. Failures in healthcare that leads to harm or data breaches are, huge, like serious fines. Like, it's not a joke, particularly in the US. And we can de-risk that big time by working in clinical UX. So I train people to do that, or I would do that work myself as an actual practitioner in research and design. So particularly there's going to be evaluative research to identify risks. But then the other massive part is more on the strategic side of things, where it's actually looking for business opportunity. How that manifests is that I might then have a client, could be a pharmaceutical company, could be a digital health company, and the work I would do was hear the brief or the main sort of objectives that the organization has, and then see, well, where are their business opportunities? Where's their risk to this? So it could be that they want to engage in a particular market, particular part of the world. And if it's a pharmaceutical company, there could be a drug that's associated with it, or it could be a digital solution. And I see, well, okay, have you thought about this aspect of that patient population that you're dealing with? Have you considered these competitors? Have you considered this gap in the market? So it's just seeing other opportunities, but it does still tie in with that general work of identifying clinical risk as well. Is there anything that could put this company at risk because they are, investing so much money so quickly before making a return on that as well? So that's more of a business risk side as well. So like I said, there's people being trained up, and me personally actually doing the research and design work, but also looking at business strategy and income streams for a product or a business as well.
I love this because this really brings in the strategy piece that I believe that all CX and UX people should be doing. And it's so often we're told that's someone else's job, or we don't need you, or we don't need to hear your ideas on that. So I love that you are doing this. I'd like to do before we get to that measuring ROI and impact. I'm going to keep teasing that. I do want to go around and ask people a little bit about their backgrounds, because I feel like there must be, I'm just guessing you might have these interesting multidimensional backgrounds, whether from education or experience or something else, because you're coming at strategy and business and humans and design or research. So let's start with Gyles. Tell us a little bit about your background in education and some of the things that you bring to the job that make what you do so unique.
Yeah, so I've never really had formal training to be an educator. I've kind of just learned from doing the job for such a long time, having a lot of periods of time to reflect on experiences with very bad teachers and instructors, and also very good ones, but also following, processes. For any work that you do, there's normally some sort of framework or process that governs it. Even in our role in UX, it's the whole user-centered, human-centered design process is already going to heavily influence what we do. So that's a big part of me having a structured way of making sure that not just when I'm actually just being this person's instructor, but even if I'm their peer, I'm their senior, I'm their junior, I'm passing on knowledge in such a way that it enables them to do something. And I think this is a common skill that is neglected in UX. There's a lot of people who have skills, but it's actually passing on those skills to others. We do need that, and particularly in healthcare, where there isn't that many specialists. Like, there's a lot of people working in this field, but they kind of just fall into it. They may not have had any formal training to enter it, which is totally fine. You've got to start from somewhere. But even the work that they do doesn't really draw upon any specialist knowledge in healthcare. It's very easy then when they do work on a complicated project that there's no one to give them that additional learning. So a big role that I have on projects, even a responsibility, even if it's an unofficial one, is how do I pass on that knowledge and skills to others so that the whole team can be built up. So it's never going to replace me, but it allows us to just work more efficiently, and also to take away some of the anxiety or even some of the shame sometimes colleagues can have, because they're like, I really don't know what I'm doing. It's like, but that's normal if you've never done this before. So it's trying to make sure that people can be on a similar playing field where possible. So yeah, the reflective practice on teaching, and also actually liaising with people who are teachers, seeing what works for them. I do have quite a lot of teachers in my professional network. And then the other thing, obviously, is working as a doctor. Working as any type of clinician gives you profound insight in how healthcare works on a global level. I've never worked as a doctor in the US, but I know enough because of my time working as a doctor in the UK to know what would generally go on out there. There's going to be unique experiences as well, but being a clinician just gives us such a deep understanding of what's working, what's failing, what are the pressures that clinicians and patients face, but also what are some of the solutions or some of the requirements for better working or health situations for both those populations. And again, this is transferable around the world, but one must keep in mind that there's going to be something very unique in different parts of the world as well. So definitely the teaching side, but also the knowledge of medicine as a doctor, I think helps me a lot.
Thank you for that. And Chris, some tales from your background.
Absolutely, yeah. So I studied biology and had full intention of being a clinician and a doctor for the rest of my natural-born life. But after studying in university, I tried out lab research, biology lab research, and then I realized that's a bit too detached from the problem at hand, and there's no patient connection. So I trained as a paramedic and worked as a paramedic for several years, and so I had clinical experience. But that felt sometimes helpless in terms of influencing the technology that kind of underpins that doctor-patient communication or clinician-patient communication. So I kind of stumbled upon design and design thinking, and really pursued that and pursued a master's in that, and have never really looked back. I think having worked as a clinician, as Gyles said, you can kind of understand the responsibility that the clinician holds, and also that level of communication that you have to have with your patient and rapport, as well as the technology that empowers patients and keeps them at home and healthy and safe, and not circling back and forth to an ER, for example. So yeah, I think all those experiences have informed my decision making. I've also worked in telehealth in rural countries, so in developing countries. So I spent some time in Bangladesh working for a telehealth platform to kind of understand the different dynamics that kind of exist in different economies. So yeah, it's all been a very instructive life.
Great, thank you. Let me pass it to Amy. A minute or two on your background.
Yeah, no problem. So I don't know if you guys been around. I was around since there was before like UI UX even existed. It was just web design when I started. And then all of a sudden UI UX design and product design came to the world, and that kind of changed things for me. It allows for me to specialize.
Sorry, I'm showing my license plate again. This was my actual license plate in California in 2011.
Okay, so exactly. Like there was like UI UX is still, in my opinion, it's kind of a growing, there isn't a very like niched place. Like it kind of, there's no way that you can point. Like either you have a specialty in UI, especially in UX, sometimes it's a rainbow of things that you have a specialty in. And I think my background gave me the opportunity to really be the rainbow and kind of cross between UI, UX, and, product design. And so I actually ended up specializing a lot in the startup world, which is a very risky place to be, but is a very interesting and fun place to be. My experience really kind of took me from starting in government all the way into like data visualization for the government, and then crossing paths with someone who said, I need a patient to do this design. And I was like, okay, well, I'm a patient. So coming from the opposite perspective of you guys being practitioners and in the space of like working with patients, I was a patient. I was constantly in the hospital with diabetes several times, wasn't well educated about my condition as well. So I had this background of knowing what it's like to be the problem for healthcare and being the person to receive the services, but also knowing the disparities that lie within the healthcare system and not having access to what I needed. So I think that gave me a different angle of entering into healthcare as a UI UX designer, bred as a web designer, and kind of like thrown into this industry and learning a lot of the techniques and oftentimes developing some of my own in the startup field where everything is moving so fast and we're looking to get funding, we're looking to ramp up, we're looking to get things tested, we're looking to get things started. So you had to be a jack of all trades. And so, yeah, not to take up too much more of your time, but that really is like a compressed version of my background and my education. I've also, of course, got into TopTal and did some coaching and training with Design Lab as well, and continue to educate others, like Dr. Gyles said, and also being educated by folks like yourselves and other medical professionals.
Yeah, thanks for that. So I want to go to the big question, and hopefully each of you will have a perspective on it, which was something that Amy brought up earlier, which was how can we measure impact and ROI for the business of the work that we do in UX, whether that's research, design, something else, both. I don't know if Chris has something to throw in on this one, but let me start this time with Chris. And what are your thoughts on how we measure this and demonstrate it to the business?
Absolutely, yeah. So it's a very interesting one actually, and I could think about some examples where we've UX is the intention is to kind of fully understand your user and find out what they actually want, and then of course then be able to package that effectively and sell it, and build features and eventually sustain a business. But I guess the easiest way to measure ROI for us is the brass tacks numbers in terms of are there sales being made, like is this product necessary in the marketplace. I've worked for several companies that startups who never really found their product market fit, and it was kind of always a struggle because patients would and users would say, I love this product, like I use it all the time, but in reality they never used it. If you don't do the ethnographic studies to see how they use it, you ask them what features do you want, and they say X, Y, and Z, but in reality they may not use those. So you really have to dig deep and understand your customers, and then plan for that. And again, the proof is kind of only in the pudding in terms of sales and revenue generated. It's hard to draw that direct link, but I think also if it's an incremental kind of agile process, if you're adding new features and you see that there's been kind of an uptick in user retention or sales, I think those are strong signs that you're following the right path. And yeah.
Thanks. Amy, tell us more about measuring impact and ROI, especially when the business is saying, prove it to us.
Yeah, so a lot of times when I'm coming in, it is either a reconceptualization and I'm here to rescue a product because they hadn't done all of the background work, they haven't done the UX research, and they're all over the place. They're quite scattered. And then on the flip side of that, it's me coming in to add additional features or to make a certain change to a specific feature. And I've come up with in my company sort of a scorecard, a feature scorecard system that allows for everybody to get on the same page about what we're going to attack. And so that truly is like, what is the business initiative? What does the business need to have happen within the first 3 to 6 months, right? Like using a time scale to say, okay, what can we get done immediately that's going to impact the business in the short term rather than the long term? All right. So from that, we kind of move into, well, what does the user want? And you kind of have to trace that back to, well, what are we marketing to the user? What are we telling the user we can do? And then what's the misalignment there? Right. And you do all that, of course, working with great UX researchers to like, where are we misaligned? What are we promising to people that they're not getting or they're not understanding? Is it the training? Is it the product? Is it the layout? Is it design? We kind of start to brainstorm about a lot of these different things. And with the alignment of what the business values are, we can usually pinpoint, okay, well, this is the problem for the users, and this is what you want to happen in the short term. Now let's ride it back to our talent in engineering. What can they do in the short term? And then, we kind of have to look at the technical debt. Okay, what's going to reduce short-term technical debt? Right. So a lot of companies, when they get funding, they ramp up too quickly and they're exploding with technical debt for no reason. Right. So we're allowing them to just kind of like understand that whatever is the short-term goal, whatever we're selling to people that they're not getting, or something is misaligned, and whatever our team can do in the short term. So you want high business value, high user impact, low feasibility. And those are the things that we prioritize. And it's just a framework. It doesn't always work for every large company, or medium. It doesn't work for every company. You kind of have to mix and mingle, and you kind of have to talk to some of the people who have a lot, like some of the SMEs that have maybe a little bit more ego than is comfortable. And you got to have to convince them of this approach that we're doing things not working. And we need to take this alignment, the business value, the user experience and what the users are asking for, what they're not getting, and then what their development team can actually get. Okay. And then that's what allows for us to get all on the same page. It's not about proving, we all know that UI UX design is important. In the B2C market, we all know, right? So we know that it impacts the way that in the B2C market, people are going to respond, or the B2B market, people are going to respond to tools and solutions too. It's just that we kind of have to get them to agree on the problem by looking at their numbers. And there are retention rates, there are expressions, there are NPS scores. There's all of these scores that you could take a look at, and it tells such a perfect story once we just align them in these 3 buckets. And so that's how I've helped people understand how to use UI UX experts, because a lot of times we're behind the wall, right? Where we're dropped into place. Oh, you don't worry about what the business initiatives are. All of this stuff feels like it's coming down, and then you're just told what to focus on. But when you convince them of, like, I can help to strategize before we're in the place where we need to rescue a product, if you allow me to come and sit in a meeting with you guys, as you guys talk about business strategy and marketing and sales, as well as, we have a big customer or client that just left. Can we go and ask them why? Right? So all of these different things are just strategies to help find alignment, right? So that we can do UI UX work better.
Thank you. Gyles, I don't know if you have anything to add to. This was the topic around measuring impact and ROI and selling this type of work to the business.
Mm-hmm. So the selling part really is ultimately about communication skills and how you're ensuring that, as I mentioned actually in the last episode, how are you making friends and influencing people? You don't have to be friends with who you work with, but generally speaking, are you trying to find out what they care about and appealing to that, where it's not direct conflict with what you're doing, trying to be human-centered in the work that you're doing? Because even working with people who are primarily driven by making money, that isn't necessarily against the idea of doing what's best for patients or clinicians. But I find that there's that piece in general, that stakeholder management piece, but also, particularly because of me coming from a medical background and also having some business acumen, there's often aha moments when I'm having those first initial conversations with clients, particularly when they present the brief and they believe they already know what should be done. And I find that's already a great opportunity to bring that return investment, where they didn't understand that there was a particular risk. They didn't understand that there was a particular opportunity, but I've presented in such a way that they've then got that insight, and it creates a change to their plan, which is going to save them money or could lead to more income based on the success of the project. And I find that is something quite important, is to try and have, it's not really technically a quick win, but it's a way of showing value because you're providing insights that no one else could. Because a massive problem that UX professionals have is that people trivialize the work we do and think it's easy.
Yep.
So when you actually present information, when you're presenting ideas and insights that literally no one else can, and people genuinely value that, it helps to build the relationship, but also build the authority that UX is supposed to have, just like all other disciplines tend to have on teams. So then when actually you do have success, people start attributing it directly to the actual work done by UX professionals rather than project managers or developers or even a senior manager that doesn't even get their hands dirty on the project, taking the credit. So I think that's something that's unique to UX, the discipline, and it can manifest itself sometimes more uniquely in clinical UX, because again, there's times where most of the people on the project have never worked in healthcare before, don't come from a clinical background, don't know about the disease or the actual health environment that they're trying to impact. So when you come in and present information that makes them much more aware of what's going on, and I suppose if it can help to make them look good as well, your standing in the team goes up. So, you've got to keep these sorts of stuff in mind. But definitely you need to be thinking about what are the actual key metrics of success from the get-go. Is the measure that we have this number of people using the product? And it can't just be, oh, they registered. Like there's a lot of, I even do it sometimes. You got an event, did loads of people sign up for the event? Great. That's a measure of interest. It doesn't mean they'll all turn up. And furthermore, even if they do turn up, will they continue to engage with the brand that's created the event? You're going to have more events in the future. So it's really important to not just have a metric that is more of a vanity one, I would call it. You want one that really is showing insight that someone is changing their behavior, having a change in impact in their workflow or their health outcomes because of this interaction, and get alignment of that from the get-go. And research being done on this project should tell you whether those metrics are even realistic, because the metrics are kind of tied to like SMART goals. Is this actually smart? Is it, specific and, all the rest of SMART? I forget some of it, but the point still stands. Have success metrics defined early on, and make sure that you've got ones that you believe you can achieve. Don't set yourself up to just win, but, they should be fair, but still have something that is realistic, smart, something that's smart. That's how I'll answer.
Just a caveat to that too, Dr. Gyles, real quick, is learning how to ask those hard questions. That's such a big part of communications, to communicating in the UI UX design space as well. Is like, can you guys tell me how great you did in sales? And oftentimes that's putting somebody on the spot too. Like it's putting somebody on the spot who might not have wanted to be on the spot, but how do you ask that question so that it's more constructive, as opposed to like, you're not doing well in sales, or you're not doing well when it comes to business, you're analyzing the business. A lot of companies don't understand their own data too. So being able to like pull that information and ask the hard questions, like, can you explain your information or your sales data or your business information? Can you explain it to me? And then allowing them to, sometimes they just open up and say, you know what, we're not actually tracking, our use that well, so on and so forth. Oh, there's a question.
Yeah, I wanted to quickly say thank you for all of that, because I think one of the biggest things that we sometimes don't talk about with the important people in the business and stakeholders is, do we know why? People always have lots of data, but they sometimes don't know why people do or don't do things, and that's where I think a lot of our work can really shine and have that immediate value. Carolina has a question, or at least a comment. Let's see what it says. Nowtimes, it is very important, not just for products, but also for doctors to have visibility online. What are some important points for a UX designer with a non-clinical background to keep in mind while creating products for doctors? Interesting. Okay, we'll have to do the lightning version of this, since we're going to have to wrap up soon, as we're about 35 minutes in. But let's go around. Everybody, we'll start with Amy. Amy, lightning version. What should a UX designer keep in mind when creating something for doctors?
I would say that is access to information. When you're designing around health data or health information, you really got to be careful, especially when it's geared towards patient, because I'm a patient myself. You really have to learn and educate yourself on what data literacy they have, where their educations are, just understanding patients in general. It's a bigger answer for this question. It's so much bigger than that, but I'll allow for Dr. Gyles to open up about that as well.
Yes, okay, let's jump over to Dr. Gyles, the lightning version of what a UX designer should keep in mind.
Yeah, keep in mind that doctors don't know everything. There's this regular narrative that doctors, if you become a doctor, you must be super intelligent. Actually, they're just very good at passing exams. That's the common thing. There may be other stuff that's common about it, but it doesn't mean they're really intelligent. And it's important I stress this, because I've come across people like this, but also because of the point that just because you think that they're very intelligent doesn't mean that you shouldn't be providing them with the additional information to make sure they're equipped with all the knowledge that they need in that moment of time. Just like with any other user, you have extremes, you have limited users, you have doctors who have disabilities, that have cognitive impairment. You have them who are compromised because of the situation that they're in. So what have you done? The same principle of human-centered design, any other situation. What have you done to make their life as easy, as simple as possible, and
Yeah.
to remove as much thinking required to do the task related with the digital product that you've produced? So just don't assume that, you know, they just know everything and they'll just find their way. Like, it's not as simple as that.
Love it. Thank you. Chris, lightning version, UX designers for doctors.
Absolutely, yeah. Just to reiterate kind of what Dr. Gyles says, they're often, the clinicians are often time poor. They're depending on the kind of society that you're in or what country you're in, they're often pressured in terms of time, and they have a way of operating that you kind of have to understand and adapt to. I don't know if Dr. Gyles would agree with me, but I think clinicians, while they may not be all-knowing, they oftentimes think they are. So they can be a stubborn lot. Really learning about how they, process their information, how they conduct their practice, and seeing how you can kind of work around them rather than asking them to kind of bend to your flow at times. So.
Yeah, and also,
no, go on, Amy. I'll add my bit afterwards.
Because I feel like I butchered the first answer. There's two different medical professionals and doctors. There are those who are really looking for innovation, really looking for change, and really looking to optimize the experience. So keep in mind that there are those kind of medical professionals that exist, and then there are those who are so stuck in that place where they love tables, they love charts, they don't want anything to change. So there's this scale where you kind of have to think like there's two sides to the coin.
100%, I agree.
Yeah.
Yeah, the other thing I wanted to add, I'll try not to be too negative about this. When you're dealing with users, but also stakeholders who hold positions of power, they're going to have responsibility that's really, really important, such as a doctor, because they make life and death decisions. It's very common that the more ignorant, arrogant that they come across is tied to their ego and their stubbornness. Like there's a lot of times where, because they have such a high position, if they really don't know what they're doing, they're going to dig their heels in. They're going to be harder to engage with, which makes it even more important to really understand what, not just their sphere of influence, because it can be very powerful sometimes. So if you're on the wrong side, it can cause you problems. But just knowing what actually do they know about, where's their comfort zone, help them excel in their zone of genius on the project. There's a lot of times people can provide a lot of value, and you help them play to their strengths. And keep that in mind when designing for them as well, because they may not want to deviate into other activities that they think is beneath them, or otherwise actually something they just don't have the knowledge and skill to engage with. And this is something that definitely comes up when dealing with doctors. There's a lot of workflows, a lot of tasks which are not technically supposed to be done by a doctor, but could be. And it's supposed to be done by a nurse. And if you're changing the workflow to get the doctor to be the nurse, some of them, they're going to get the ego, the arrogance is going to mean, why am I doing this? Rather than focus on it's for the patient. So it's complicated. I'm not going to lie, it's complicated. But it's being aware of this allows you to be prepared. So forewarned, forearmed is the phrase that comes to mind there.
Yeah, this is great. And Carolina, thanks all of you for that. So to wrap up, since we're running a little late today, I like to ask each guest, we'll go around to please spell your name so that people can make sure that they're finding you online. And where can we find you, connect with you, any website you want to mention? So we'll start with Chris.
Sure. My last name is spelled Bredie. I don't have anything to pitch, but you can find me on LinkedIn. And feel free to message me and ask me any questions. Very happy to have a chat anytime.
Great. Thank you so much for being here. And Amy, where can we find you? And please spell your name.
Awesome. You can find me on LinkedIn. It's Amy, Amy Oughton is my last name. You can also find dreamincolor.co. So you can spell that in your URL and Google that. A whole bunch of stuff should come in. And also, if you guys are interested in purchasing a book that I co-author, which is the Diabetes, Digital Health, and Telehealth, you can do that. It was published by Elsevier as well.
Excellent. And congratulations on that. And Gyles, where can we find you and follow you?
Yeah, so even a Google search will pop up for a few things. So it's Gyles, Gyles, then Morrison, Morrison. And obviously on LinkedIn, please feel free to reach out to me. There's also the Clinical UX Association. You can find out details about the clinicalux.org, find out more about the CUXA, that's Clinical UX Association for short. That's music playing from my daughter's tablet in the background as well. She loves to play that loud right at the end of recordings. So yeah, clinicalux.org, and that finds out more information about what the CUXA does in evangelizing about UX in healthcare, raising the standards and the use of research and design to improve health outcomes for all. And we've got a launch event for that on March 21st, depending on when you're listening to this recording. Thank you.
Yes, this will come out the day before, so hopefully people will spread the word and follow you on LinkedIn. Just a reminder to check out our other events at cxcc.to/events. We're going to be shifting away from Google Meet back onto YouTube streams, and so please subscribe on YouTube, CX-CC. Thanks again to our panel for joining today, and for Dr. Gyles for helping us put this together. And I'm going to hit the stop recording button, which takes so many clicks.